Okay, welcome to our Basic Disabled Care 3, the last topic of our Basic Disabled Care. So again, in this module, you are going to receive separate grade from your Basic 1, Disabled Care 1 and 2. So it caters to your assistive devices, gait pattern, and of course the home management when it comes to your client with disability. Now, we have assisting the client or the patient to ambulate. So I have taught you somehow how to do ambulation with our in combination with the return demonstration of your wheelchair. So ambulation is the term given to move the body by walking with or without assistance. So once the client has tolerated sitting in the chair, the next step is to begin to walk. So when it comes to recovery, dapat you're going to do it step by step. So as it was indicated, when the person or the patient will be advised to sit down, then of course to stand, and then of course after standing, to walk slowly. And the physical therapist will instruct the client and caregiver about any special techniques required and will prepare a schedule for daily ambulation. Your role as the home care aide or caregiver is to assist the client as needed, making sure that the physical therapist's directions are followed. So in general, you have to follow the doctor's order, not only the physical therapist. Then sometimes the client may want to walk longer than the direction allows. No, you have to do it slowly, ha. You will just tell your client, up to this point lang po tayo, hindi tayo pwede mag-proceed. Kasi you will going to prevent exhaustion or too much exhaustion in the part of your patient. Always follow the physical therapist's direction again and record your client's request and notify your supervisor for instruction. Okay, if there is an additional instruction. When assisting your client to walk, follow these general rules. One is assist client to put on the gait belt if needed, especially if there is too much weakness noticed. So you have to assist the client to the standing position, then count to 10, or you may have it, you have it shortened up to 3 lang po. Then count to 3 before proceeding. Then stand by the client's weaker side and slightly behind him. Okay, remember, what we did in our demonstration is you are facing with your client. But when it comes to walking side by side, you have to slightly, it is stated that you have to slightly behind the client. So grasp gait belt in back with one hand while placing other hand in front of the collarbone on the weaker side. Again, our demonstration is done by facing the client, but you could also walk side by side with the client, but granting that you are slightly behind. Do not rush the client and allow plenty of time. Good body mechanics in doing so, and if client becomes tired, wait a few moments before proceeding. Calmly encourage and reassure the client as needed. Okay, how are you going to encourage or you have to reassure the client? So you have to encourage the client to walk, especially if you notice that the client is capable of walking, but maybe he has fears that he might fall down. But as you have observed, the patient is able, because there is no noticeable exhaustion in as evidenced by increased respiratory rate, or maginga-ginga na yung ilong, or flaring of alay nasty, diba? Or yung opening niya sa nostril is magbigger siya. So that would mean the patient now is already exhausted and grasping for oxygen. But if not, you may now proceed accordingly, as long as the patient would be encouraged on doing more steps, okay, doing more steps, and then record the distance walk, amount of time spent in walking, how the client tolerated the activity. So those are the things that you have to record, and record any difficulties such as dizziness, weakness, pain, or breathing difficulties. So those are the things that you have to report also. Okay. For example, those things happens. So if those things happens, the next time that you're going to ask the patient to walk or ask the client to walk with you, you have to remember those things that he has experiencing. So, pwede naman siya pangutanan, okay, this time, how would you feel? Or are you dizzy? Because if you are, we will cancel our walking. So, you're going to ask questions beforehand. So, because you have already a basis. Kasi may nangyari na sa kanya previously. So, you don't need or you need not to repeat it anymore. Okay. Then, ambulatory aids. So, your ambulatory aids are considered as assistive devices which are prescribed for a variety of reasons. Okay, what are the reasons na i-prescribe po si ambulatory aids? This includes problems of balance, pain, fatigue, weakness, and joint instability. Another primary functions of assistive devices is to eliminate weight bearing fully or partially from an extremity. This unloading occurs when transmission of force from the upper extremity to the floor by downward pressure on the assistive device. Okay, so remember that. So we have, mga functions niya po, is to eliminate weight bearing fully or partially from an extremity. So, kailangan for example, yung left leg yung injured. So, dapat yung weight niya po, hindi po dapat ibigay dun sa left leg or sa injured leg. Kasi pwede siyang, it will suffer from poor healing process or worse. Because of your pressure applied on it due to your weight, it could aggravate the condition. Okay, pwedeng mapasama po yung injury ng client. Okay, so next is your parallel bars. So parallel bars are where gait patterns are initiated and the evaluation of the fit of the ambulation aid is performed. So, provides maximum stability and support. Ang lahat ng assistive devices that provides maximum stability and support is your parallel bars. So, the height should be at the level of the greater trochanter of the patient or at the level of the ulnar styloid process of the extended and abducted arm, and that should allow 20 to 30 degrees of elbow flexion. So when you say 20 to 30 degrees, I'm going to show it to you during our demonstration. Dapat yung arm nyo po, yung holding ng parallel bars are slightly flexed. There should be 2 inches gap between the greater trochanter and the bars on each side. Yes, para hindi naman masyadong makipot po yung bar or diba yung distance, kasi pag makipot po, you will have a problem in walking. Patient should grasp bars 6 inches anterior to his hips. Okay, remember 2 inches gap between the greater trochanter and the bar, and then we have also the patient grasp the bar 6 inches anterior to his hips. So you note that statement. Another thing is the height should be at the level of the greater trochanter of the patient and at the level of the ulnar styloid process of the extended and abducted arm, and that should allow 20 to 30 degrees of elbow flexion. Okay, remember parallel bars. And then next we have your walker. So in the demo we don't have the parallel bars, but you take note those parallel bars placed on ramps, diba? And then on the sidewalks, those are parallel bars. So next is the walker. Walkers are small metal stand that the client leans on when walking from place to place. They are used for clients who have difficulty with balance or are weak and need additional support. So, support of all the types of assistive walking devices, your walkers offer the greatest amount of stability because the walker has 4 legs. Okay. Among the assistive devices, the walker gives you the greater amount of stability because it has 4 legs. And because they provide 4 points, diba? Kasi 4 legs na. Some walkers have wheels and are pushed around. Some are moved by lifting, some are moved by lifting, and others have seats attached so that the client may rest when necessary. So you try to look at the red color, ha? So yung iba, may seat po siya sa front. Ito po wala. Wala po siyang seat. Ito walang wheels, yan merong wheels. Pero nga lang, wala siyang seat. Okay. So, next is the gait pattern. Prior to initiating instruction in gait patterns, several points related to use of the walker should be emphasized with the patient. The walker should be picked up and placed down on all 4 legs. Dapat magkasabay po silang i-pick up, magkasabay din po silang i-put down simultaneously to achieve maximum stability. Kasi pag hindi mo masabay silang i-put down, the tendency magiging imbalance yung patient. Or there will be rocking from the back to from legs or sliding the walker forward should be avoided because it decreases the effectiveness and safety of the assistive devices. So, dapat sabay po siyang i-put down or yung wheels niya po ay sabay din po dun sa back po na foot ng walker. The patient should be encouraged to hold the head up and to maintain good posture alignment. Dapat So, dili po pwede na the patient will going to look down during walking or in walking with walker. Bakit po? Kasi there will be tendency that he will be tripped off. So, dapat he will look forward. Okay, forward. And the patient should be cautioned not to step too close to the front crossbar kasi pag too close po yung patient sa crossbar, ang tendency na po, this will decrease now the overall base of support and may cause the patient to fall backward. Kasi yung weight naman ng patient ay mapupunta sa front, causing now the patient to fall. Okay, kasi yung base of support niya po ay maging, di na po siya balance. There are three types of gait pattern used with walkers. These are full, partial, and non-weight bearing gaits. Okay. So full weight bearing, the walker is picked up and move forward about an arm's length. The first lower extremity is moved forward. That is your full weight bearing. And the second lower extremity is moved forward past the first. So, pag full weight bearing po, ang problema ng patient dito is weakness lang po. Weakness. While your partial weight bearing, so there is your injury. The walker is picked up and moved forward about an arm's length, and the involved lower extremity the involved was your affected leg is move forward, and body weight is transferred now partially onto the wrist limb and partially through the upper extremity to the walker. The involved lower extremity is moved forward past the involved limb. The cycle is then repeated. Anyways, we were going to show you the procedure. Okay. Next, we have non-weight bearing. The walker is picked up and moved forward about an arm's length. Weight is then transferred through the upper extremity to the walker. So yung weight mo ng patient, i-transfer niya po, i-apply niya po sa walker in non-weight bearing. The involved limb is held anterior to the patient's body but does not make contact with the floor. So the uninvolved limb is moved forward, then the cycle is then repeated. Okay, the cycle is then repeated, excuse. Measurement. The hand width of the walker should be approximately be at the level of the greater trochanter of the patient. And allow 20 to 30 degrees of elbow flexion, just like your parallel bars. So remember those. Next is your cane. The functions of the cane is to widen the base of support and to improve balance. Canes are not intended, excuse. Again, the cane function to widen the base of support and to improve balance. Canes are not intended for use with restricted weight beared gait such as non or partial weight bearing. So, hindi pwede yung partial at non-weight bearing sa cane lang ha. Kasi yung sa cane, restricted lang po siya sa weight beared gaits. Patients are instructed to hold the cane in the handle opposite to the affected side. So remember, the cane should always be placed opposite to the affected side. This positioning of the cane most closely approximates a normal reciprocal gait pattern with the opposite arm and leg moving together. So again, the cane should always be placed opposite to the affected side. It also widens the base of support with less lateral shifting of the center of gravity or COG than when the cane is held on the ipsilateral side. This assistive device transmits 20 to 25% of body weight. This is used to relieve pain, pathological joint changes at the knee or ankle. This is indicated for patients who need minimal support for minimal balance and endurance problem. Excuse. So this types of cane, we have the standard cane. So this ambulatory aid is referred to as the regular or conventional cane. It is made of wood or plastic. The distal rubber tip is at least 1 inch in diameter or larger. So you look at it all, the distal rubber tip is malaki po siya. This cane is inexpensive and fits easily on stairs or other surfaces where space is limited. The standard cane is not adjustable and must be cut to fit the patient. Its point of support is anterior to the hand and not directly beneath it. Okay, remember that ha? So, standard adjustable aluminum cane. This has the same basic designs as the regular or standard cane. It is made of aluminum tubing. It is quickly adjustable, facilitates easy of determining appropriate height, more costly than standard cane. So, ang standard adjustable aluminum cane is more costly. This is more costly than the standard cane. So, asa na po yung standard aluminum cane? We have here your letter B. Okay, kasi yung A, wooden cane. And yung C naman is adjustable offset cane. Okay. So, adjustable offset cane is the defined as the proximal component of the body. If this cane is offset anteriorly, it is made of aluminum tubing with a plastic or rubber molded grip-shaped handle. The design of this cane allows pressure to be borne over the center of the cane for greater stability. This cane also is quickly adjusted, lightweight, and fits easily on stairs. This is more costly than the standard and adjustable aluminum cane. So, mas mahal po yung aluminum offset cane. Oh. So number 4 is your quad cane. The quad cane is as the picture shows. Yan po, mandami. This cane, this is the most balanced among all canes, the quad canes, because apat po yung paa niya. So we have here this cane is constructed of aluminum tubings. The characteristic features of this cane is that they provide a broad base with 4 points of floor contacts. Yes, the patient cannot be tripped off with this aluminum cane. Pero medyo mas mabigat lang siya compared to the other canes. The legs closest to the patient's body are generally shorter and may be angled to allow foot clearance. On some designs, the proximal portion of the cane is offset anteriorly. This provides a broad base of support, and this cane is also easily adjustable. Yes. Not practical for stair climbing kasi nga apat yung ano niya medyo bulky siya. Use with a slower gait pattern. If a faster forward progression is used, the cane often rocks, which decreases effectiveness of the cane. So, hindi po siya pwede sa mga mabilisang paglalakad. Si quad cane, ha? Kasi nga, may tendency na matrip off ka. Dapat slowly lang. Number 5 is your walk cane. This cane is also constructed of aluminum and aluminum tubing. It provides a very broad base with 4 points of floor contact. This type of cane is more stable than the quad cane. So, walk cane po is more stable than the quad cane. This cane also falls flat for travel or storage. This cane cannot be used on stairs. Okay, kasi mas mahirap na gamit sa stairs kasi bulky naman siya masyado. Then measurement. Place the cane approximately 6 inches from the lateral border of the toes. The hand grip of the cane is approximately at least at the level of the greater trochanter, and the elbow should be flexed to about 20 to 30 degrees flexion. So remember, lahat po 20 to 30 degrees flexion, even crutches. Okay, the last assistive device is the crutches. This ambulatory aid will increase base of support, improve lateral stability, and allows upper extremity to transmit body weight to the floor. So we have here your parts. So first is your auxiliary bar, the hand grip, double upright, single upright, 12 suction tip. This type of crutches will transfer as much as 80% of the body weight. This improves balance and lateral stability. Provide functional ambulation with resisted weight bearing. It is easily adjusted and inexpensive when made of wood and can be used for stair climbing. But this causes neurovascular injury such as your crutch palsy. That is why you have to maintain 2 inches distance between your auxiliary bar and the axilla itself. It is but this cause it requires good upper extremity strength and safety of user is compromised in crowded areas. This is indicated for patients with normal upper extremity strength, good balance, and good coordination, and could be used in any weight-bearing status. Okay, next is your non-auxiliary crutch. This ambulatory and aid transferred as much as 40 to 50% of body weight, while forearm crutch or loft strand crutch, parts you have single upright forearm cuff and your hand grip. This ambulatory aid allows the hands without the crutches becoming disengaged. It is easily adjusted and allow functional stair climbing activities. It is more cosmetic and fit easily into the automobile. So that's your non-auxiliary crutch. But it provides less lateral support. The forearm cuffs may be difficult to remove and more costly than the wooden auxiliary clutch. A platform clutch. This type of clutch allows weight bearing on forearm. Measurement. We have general measurement. 77% of the patient's height is your crutch. Subtract 16 inches from the patient's height. So that will be your crutch. Okay, next is your standing. Crutches should be measured from a point approximately 2 inches below the axillary. Width of 2 fingers is often used, approximately 2 inches below the axillary. And the distance end of the crutch is 2 inches lateral and 6 inches anterior to the foot. Remember, anyways, I'm going to demonstrate it to you when we're going to have the actual of your crutch, using your crutches. So handpiece should be adjusted to provide 20 to 30 degrees of elbow flexion. Iniisa-isa kasi dito sa book, pero normally, pareho lang po yung statement ng lahat. And then supine, so nakahiga. Measure from the anterior axillary fold to a 6 to 8 inches or 5 to 7.5 centimeters from the lateral border of the heel. Okay, that is the measurement. And sitting, upper extremities are abducted at shoulder level with one elbow extended and the other elbow flexed at 90 degrees flexion. Measure from the olecranon process of the flexed elbow to the tip of the middle finger of the opposite upper extremities. Anyways, you would notice this one when we're going to do the demonstration. For arm crutch measurement, distal end of the crutch 2 inches lateral and 6 inches anterior and the base of the little toe. So hand grip is 20 to 30 degrees flexion should be assumed. And then the cuff is 1 to 1.5 inches below the elbow. And then we have also your crutch walking muscles. So we have scapular depressors, we have stabilized the upper extremities and prevent hiking of the shoulders on weight bearing. The following scapular depressors are latissimus dorsi, or lower trapezius and pectoralis minor. So these are the muscles involved in your crutch walking. And shoulder abductors, to hold the crutch top to the chest wall with the arm. The following shoulder abductors are pectoralis major and latissimus dorsi. So shoulder flexors, extensors, and abductors. This enables a placement of the crutch forward, backward, and sideward respectively. So then it also includes the deltoid muscles. So elbow extensors. Stabilizes elbow is weight bearing by preventing flexion or buckling. This includes your triceps brachii. So while your wrist extensors hold wrist in proper position to bear weight on the hand grip, and then this includes your extensor carpi radialis and extensor carpi ulnaris. Saan ba yung extensor carpi radialis? So sa wrist nyo po. Sa wrist nyo po makikita. Then, your, di ba, radio ulna? You have your radius, then the ulna. Then, so, in your folds sa wrist, yun po yung wrist extensors. From the word wrist. Okay, next is your fingers and thumb extensors. So, naka-flex po yung kamay nyo na naka-hold sa crutch. So, this muscle serves to adequately grasp the hand grip, diba? Flexors digitorum superficialis and profundus. Flexor pollicis longus and brevis. Do not memorize all those muscles, ha? I'm just talking about it since sometimes kasi you should know as to what muscles involved or necessary to function during using a crutch. Now we will proceed with the gait pattern, which is very much important. So, first is your 3-point gait. In this type of gait, 3 points of support contact the floor. It is used when non-weight bearing status is required on one lower extremities. Body weight is borne on the crutches instead of on the affected lower extremity. is your three-point gate. So when you say three-point gate, there would be three pattern that we're going to touch the floor. So just like this one, you would notice this. Okay, I'm going to change the cursor. Okay, this one and this one. This represents the crutch. This one, the circle here on the left and the circle on the right represent the crutch. And then we have here the foot, blackened foot. So that is now your right foot. So as you have noticed, there is no foot available here. So meaning the patient is an amputee. So here, starting point or starting position. In this pattern, you have the left lower extremities non-weight bearing. So this is now your three-point gate non-weight bearing. Bakit 3? Tatlo lang po yung nakatouch sa floor, nasa floor. Isang leg lang crutch and the other leg of the crutch and then one foot. So weight is then shifted onto the uninvolved right lower extremity and then the crutches are advanced. First is your crutches, so the two crutches, and then followed by your unaffected leg. But in this pattern, you have to swing your affected leg so that the force would be shifted to the wheelchair, but to the crutches. The weight is then shifted to the upper extremities onto the crutches, and then the uninvolved limb advances beyond the crutches. Okay. Dapat yung uninvolved leg mo po is medyo advanced siya ng konti compared to your crutches. Okay. And then we have there the unaffected limb may initially be brought to the crutches and later progress beyond. So here, an affected limb may initially be brought to the crutches and later progress beyond. So, pwede, at first is pwedeng yung force niyo po is hindi po siya masyadong adequate. So, pwedeng parallel lang po kayo ng crutch. But the right thing to do it is you have to make your foot, the unaffected leg, to be advanced beyond your crutch or your crutches. Okay, that is your three, so the indicator would be then both crutches are advanced. So after the foot being advanced, you're going to advance again the crutch. So the cycle is then repeated. Okay, next is your what's this? Is your two-point gate. Two-point gate, so dalawa po yung magkasabay na nag-touch ng floor and then followed by the next one. Nagsabay din. So, tingnan niyo po, either dalawa silang dalawa yung etong button na to, I will change it to red so that you could see it. So, itong crutch at yung left crutch at right crutch ay kasabay na nag-touch ng floor and then followed by your both legs. Okay. Kaya nga blacken yung dalawa. Di ba kaya sa three-point gate walang paa yung isa? Kasi amputee po siya. Okay, next. So again, the two-point gate. So this pattern is similar to your four-point gate. However, it is less stable because only 2 points of floor contact are maintained. Thus, use of this gate requires better balance. Two-point patterns more closely simulates normal gait. So parang ano lang siya, yung normal na pag-walk. So tingnan niyo yung first here. So standing position weight is borne on both lower extremities and both crutches. Excuse. Ito po yun. So sabay silang dalawa first and then followed by the 2 foot. And then next is here, number 2, the left crutch is advanced and then the right crutch and left lower extremities are advanced too. So pwedeng ganito ha, pero ito, tingnan nyo. Ito yung left crutch at yung right crutch. Right leg. Magkasabay po silang dalawa. Tingnan mo, 1 and 2. And then followed, of course, by your left. This is the left crutch and then the right leg. And then followed by your right crutch and then the left leg. So sabay po sila ang left crutch and then the right leg, sabay po silang nag-touch sa floor. So 1, that is counted as 1. And then the right leg and then the left crutch is followed them along. So meaning sabay din po sila. So kaya 1 and then 2. So the right crutch and left lower extremities are advanced together and then the cycle will be then repeated. So that's it. That is your 2-point gait. So as Madam said, pwede rin swing to or swing through. So yung dalawang crutch is advanced followed by your 2 foot here. So pag swing to, meaning 2. 2 would silang upat. But swing through meaning swing through. So lapas ang duha ka foot sa duha ka crutch. Okay, swing to and swing through patterns. These gaits are often used when there is bilateral lower extremities involvement, such as in spinal cord injuries. Yes. The swing to gait involves forward movement of both crutches simultaneously and lower extremities swing to the crutches. In the swing through gait, the crutches are moved forward together, but the lower extremities are swung beyond the crutches. So, again, pag swing to meaning toward, swing through meaning advanced. Okay, copy. And then we have partial weight bearing gait. When you see partial weight bearing, tingnan mo yung indicator, blacken yung isang leg, pero yung isang leg hindi. So, you would notice that this gait is a modification of the 3-point gait pattern. Modification, so yung 3-point gait, wala pong paa yung isa. Pero sa partial weight bearing, meron po. During forward progressions of the involved extremities, weight is borne partially on both crutches and on the affected extremities. So, first is you're going to advance your crutch. Okay, this one. And then after advancing the crutch, the crutches, I mean. And then after that, baliktad ata itong indicator na to. So, you're going to advance here, ito yung tingnan natin. Yan. So, you're going to advance now the crutches. And then, so that would be your 1. And then partial, you're going to tiptoe. So, parang mukinto ka, kaya hindi blacken yung foot kasi partial weight. Yung partial of your, part of your weight is going to be bared by your affected leg. So, that's why partial. So, 1, and then 2, and then we have 3. That is why it is a modification of your 3-point gait. Okay, so I will not read anymore the indicator. So you have seen it already. So again, here all your leg. The next slide is your 4-point gait. Ito yung starting point ng kasi nagkahalo-halo na sa book ng paglagay sa PowerPoint, medyo nagkahalo-halo. Kasi sa book kasi, diba, as you have noticed sa book, yung number 1, just like here, or the 5 and 6, I intentionally put it below so that you would read it in advance compared to the upper part kasi pattern ng paa yung pag-inano natin. So, pag inuna ko yung number 6, ang tendency, hindi nyo ma-understood yung pattern. So, inuna ko below yung, mas dapat pagbasa nyo po is, dapat unahin yung below part kasi kaya nga may numbers, diba? Okay, the 4-point gait. This pattern provides a slow, stable gait as 3 points of floor contact are maintained. Weight is worn on both lower extremities and typically is used with bilateral involvement due to poor balance in coordination or muscle weakness. In this gait pattern, one crutch is advanced and then the opposite lower extremities is advanced. So, pag sinabing 4, so 1, 2, 3, 4. So, ganito yun. So, tingnan niyo yung paa. So, first is you have to advance the crutch, this one, followed by your opposite leg here, and then the crutch again, then followed by the crutch. So, 1, 2, 3, and 4. Pwede rin yung 2-point gait, pwedeng silang dalawa sabay at sabay din kag dalawa. So, there's your 2-point gait. But pag 4, 1, 2, 3, 4. Pag 2, 1 sabay, and then 2. Ha? So anyways, we'll be demonstrating those procedures to you. Now, we'll proceed with the self-maintenance. Basis of your self-maintenance activities including feeding, upper and lower extremity dressing, and your grooming. Actually, your health maintenance depends upon the affectation of a particular injury to a person, ha? Depende po yun. For example, kamay. So, kailangan niyo yung mga kubiertos. O, di ba, yung spoon and fork and all. So, dapat you have to fit it accordingly to the need of the person or to the need of the client who is happen to be disabled or handicapped. Okay, so I have here your scoop dish and plate with plate guard are used by pushing food against the wick to scoop it. Scoop. It also aids as a guide. So here po yung scoop dish. Pa hindi po for example, pag sample cerebral palsy, there will be rigidity and of course there will be involuntary jerking movements. So hindi po na makontrol yung kamay nila. So kailangan yung mga pagkain nila po ay may guard. What do you mean by guard? Hindi po siya basta flat. Kasi pag inaano niyo ng spoon, so alis na po yung mga pagkain sa plato. O, diba? Mahulog po silang lahat. So, kailangan may plate guard. Okay. So, these are the self-feeding involvements. You just read the indicator. I won't be enumerating those because you have the book naman. You just read it anyways. It is understandable. And it was stated there simply. Okay, here. And then another, we have here the cups. So, dapat medyo may handle po lahat. O, yan po, may handle po siya. And medyo okay, here. And you have the dressing. Actually, the dressing is just similar to those of that normal dressing. But there is long indicator that you have to place the dressing in place in case if there is what we call this one, involuntary jerky movement. Example of those, we have your disease or affectations, or we have the diagnosis of your cerebral palsy. So again here, you just read and go along with it. Just like here, the socks, just ko naman. Pag ganito naman po yung, anyways, it was included by our physical therapist before, but for sure you have down your your aid in putting on socks, but definitely I disagree with this. Bakit? Bakit naman kailangan natin gamitin yung aid? Pwede naman tayong, yung object na aid, pwede naman tayong magkaroon ng human aid, diba? Just like your caregivers. So, tapos ang hirap kayo magsuot ng stockings na rigid yung both legs mo. Tingnan mo yung, this is what we call this one. The person has cerebral palsy, I guess, or there's developmental age deficit or cognitive abilities. But anyways, this is also one way to motivate them to do the putting on the socks and all. But of course, if you've seen them putting on their socks in their, let's say, unfavorable condition, so it is not, most likely, I don't agree with that. Okay, and then you have your grooming and hygiene. You just try to read those, Anyways, I'm going to include those in our quiz or our exam. So, bowel and bladder. So, those are self-explanatory. You just read it so that you could have an input about that or insight about that. Even menstrual care, it was included there. Okay. And then the bathing. So anyways, we have now your communication pattern. So those are the mostly self-explanatory. You just read it all along so that the wheelchair dimension, I guess I have enumerated this one. You just read that so that you could be able to get what is being emphasized, and then especially the ramps. Anyway, at your ramps, when you're going to have the ramps, make sure that when you're going to if you're going to go up, you have to make sure that you are at the back of the patient. At yung at the back of the patient, kailangan mas nauna yung patient sa'yo kaysa sa'yo. Example, sa wheelchair. Una yung wheelchair, tsaka it will be followed by the caregiver. But when you're going to go down, so definitely hindi pwedeng mauna yung patient na naka-wheelchair. Dapat mauna yung caregiver, tsaka yung patient. Kasi pag nauna natin yung patient tsaka wheelchair, of course, the weight of the wheelchair is much heavier than you. Then definitely, if you're going to move that fast, and of course, it could cause injury to our patients. So, you just read. In the placement of doors, here, yun na masyadong clear. Hindi kasi dinrawing, kinapik, in-scan lang po sa what we call this one, sa computer, and then the place of the bathroom and all. Yung bathroom kailangan pwede malagyan ng wheelchair sa loob. So yan. You just learn, so we have here the kitchen, and then the place of the kitchen, the bedroom. Anyways, you have your handouts. Okay, and then I won't be including the different acts about disability. It is not for you to study it anymore, because all you need to do is to give service and to make sure that the patient is comfortable. That's all. Moral na siya. Okay. So that will be all for our Basic Disabled Care 3. So thank you very much. And if ever that you happens to have any questions, you may text me or PM me or something because para magkasinabot ka. Anyways, we'll be demonstrating all of this to you and through videos and actual performance. That would be all for now. Thank you very much and good day, IHL.